Bill, how about at electronic health records? Top priority for you this year?
Well, I'm gonna give you a couple.
Sure.
So when I talk to my team, we talk about operationalization and we talk about convergence. So those are fine words, but what do they mean to us at the firm and what we're trying to accomplish? From the operationalization perspective, I mentioned up front, the firm is here to be to bring together the work of the VA and the DoD on a single common federal health record. But you can't have three operators of that federal health record. You need you asked me about programs before, you effectively need a program manager, an operator, to bring all the pieces together and make sure that we effectively deliver that to those two departments, the U.S. Coast Guard, who is already using it, and potentially other healthcare providers in the federal healthcare enterprise. You know, we've had conversations with NOAA, we've had conversations with NSA, we've had conversations with the Indian Health Service, and I don't know if those will come to fruition, but I think we're poised as a firm and as a federal enterprise to offer capabilities that to smaller healthcare providers in the federal space that they probably couldn't afford, because DoD and VA have borne the upfront cost of creating this tremendous capability. So pushing that forward, being the single operator, pushing that forward, continuing to drive this is the convergence piece, the convergence between the DoD, the VA, and the Coast Guard from a functional and a technical perspective, so that we can make sure that we simplify and simplify the operations of the IT that supports the healthcare delivery, but also create as much commonality in the healthcare delivery side so that they're interoperable from a process perspective, as much as appropriate for those health systems. And I'm not a physician or a doctor or a healthcare provider in any way. I don't want to make those decisions. I want to enable them to make those decisions by taking the IT out of their decision loop. And the real priority, and I think kind of a demonstration or a prototype for much of this from a firm perspective, is the implementation and the planning for the implementation of the Federal Healthcare Center at the James A. Lovell Healthcare Center, which is a joint VA-DoD facility in North Chicago. Getting that right, getting a synchronous deployment there, and the firm is leading that. I think that will be a prototype for what is possible from an health IT perspective to support integrated operations of two massive healthcare systems. And that's a huge priority for us in this upcoming year.